Speculation that Trump is receiving IV infusions for dementia has been going wild this week. Let's talk about it. New bruising and new bandages are appearing on that right hand. We've seen this before, and it's appearing again. So we're going to get into what I think may be going on here. But first, a special welcome back to our returning viewers. For those of you who haven't subscribed yet, we're working hard to earn your trust, and we hope you become a subscriber right now. So let's look at a couple of these viral videos, kind of speculating on this IV infusion for dementia. What is it? What's going on with that? Let's go ahead and play that first clip. This one has over 3 million views. Super viral clip.
A sitting congresswoman has figured out that Donald Trump has dementia and is getting monthly infusions for it, just like I told y'all. I'm a physical therapist with a doctorate in my field and 14 years experience working in home health care, treating patients with dementia, just like the president. This is a tweet from Congresswoman Sydney Kamlinger-Dove out of California. The Alzheimer's drug Leqembi is administered through an infusion, can cause swelling, bleeding, fluid leakage of the brain, requiring regular MRIs, can cause tiredness. She also includes a picture of Trump's bruised hand. Now, in the videos I've made about his possible drug regimen before, I've mentioned the drug Kisunla. They're extremely similar drugs, except their mechanism of action is slightly different. But they're both meant for early stage symptomatic Alzheimer's disease, and they're both given as an infusion. And they both require regular MRIs to check and see whether there's ARIA, or amyloid-related imaging abnormalities. I've said it before and I'll say it again. I think this guy has about 3 to 5 months left in the land of the living due to his possible dementia and his possible heart failure, chronic kidney disease, and history of probably TIA or stroke. A lot of you have been asking, why would they give an infusion through veins in his hand when that is a place you can see easily in public? It is most likely because the rest of his veins are shit. Because this asshole has been eating shit for years. His ego will literally be the thing that takes him down. Couldn't happen to a better guy. Thank you for your attention to this matter.
So just a brief background on that extremely viral video. What he's talking about there is the drug, or what she was talking about actually in her tweet, is the drug Leqembi. And that gentleman there also had made a video a couple of weeks back about another drug called Kisunla. And these are monoclonal antibody drugs to treat Alzheimer's disease, intended to clear the amyloid plaques that build up in the brain, which is kind of like the cause of Alzheimer's. Leqembi is an every 2-week IV infusion, and the other drug, Kisunla, is a once every 4-week IV infusion. So just a little bit of background on those drugs and whether there's a possibility that he might be receiving those. We'll see. But plenty of people are talking about this. Here's another clip from David Pakman. Go ahead and play that one.
At the latest cabinet meeting, Trump has 2 Band-Aids, where previously he had makeup covering the bruises. Doctors wrote to me, and increasingly, the belief among not only doctors, but also nurse practitioners and nurses, all sorts of medical professionals wrote to me. And they said, this suggests that Trump is getting IVs on a somewhat regular basis. The regular IV use on the top of the hands can cause bruising. And it can also cause the sorts of, I forget the word, I mean, hematoma just means bruise. There was another word that they used, but that it can cause damage to the top of the hand, essentially.
Everybody is talking about this. In fact, this last clip here is from MeidasTouch just a few days ago. Karoline Levitt was asked a question about this again at another presser. So yeah, go ahead and play that one.
This past week, you had Karoline Levitt, Donald Trump's chief propagandist. She was asked, why does Donald Trump's hand keep having bandages on it? Why does it look discolored that way? What is going on? Clearly, he's getting some sort of injections or IV. Something's going on with his hands that are not normal. Karoline Levitt, Donald Trump's chief propagandist, comes up with this. The best answer she can think of, He shakes so many hands. That's why. That's why, because he handshakes a lot of people. That's why it looks that way. Just take a look at what his hand looks like. I'll just show you some other photos of it. That's not from shaking lots of people's hands. There's an injection taking place there. There's something deeply serious happening. Watch Karoline, and then I'm going to show you what some other Trump staffers said that I think were actually even more damaging. Here, play this clip.
Yes, in the blue.
Karoline?
Yes, go ahead.
Thank you. The President's been spotted out and about a number of times with bandages on his hands. Could you please explain what that is about? Secondly, he noted on Truth Social the other day that he had aced 3 cognitive tests. Could you please clarify when those tests took place?
I can do that at a later date. I obviously don't have that in front of me. The president has spoken about that quite extensively throughout the years. As for the bandages on the hand, we've also given you an explanation for that in the past. The president is literally constantly shaking hands. The Oval Office is like Grand Central Terminal. He is meeting with more people than any of you even know about on a daily basis. He's also on a daily aspirin regimen, which is something his physical examinations has said in the past as well, which can contribute to that bruising that you see here.
So there we go again with the same kind of rationale or reason or excuse for why he might have this bruising on his right hand, handshakes. So the question becomes, is he having some IV infusion treatment for Alzheimer's or some other IV infusion treatment? Or could this bruising actually be from handshaking? There are clues to the most likely answer. So let's get straight into what those clues are. Number 1, the site of the possible infusion or the IV placement site. If Trump were receiving regular IV infusions of anything and the cannula was placed in his hand, usually we place IV cannulas for regular infusions in the non-dominant hand. So in this case, it would be his left hand. We have a tendency not to want to put that IV cannula into the dominant hand for exactly the reasons that we may see here. So there's one kind of clue that might steer us away from a regular IV infusion. Be unusual to place it in the right hand, although not impossible. I'd like to take a closer look at Trump's anatomy. So I want you to open the next photo. Let's actually look at his veins. Here's a photo from just a couple of months ago, and you can clearly see the veins that are visible in his hands.
Lower.
Especially in the right hand. And you already identified it. You said lower, or almost kind of under the bruise. Like, the bruise seems to be higher.
Bruise is a good way to
and
put
it
it.
seems
Yeah.
under the bruise. And so Trump has a prominent accessory cephalic vein. That's what that vein is called. The larger one that's sort of lower that you see. And that vein, if he were getting IV cannulas placed, would probably be the most likely vein, although the bruising doesn't appear to be in that lower vein. The bruising seems to be a little bit higher up in the hand. So again, just a small clue to maybe IVs are not being placed in that hand. I'm not saying you can't place an IV higher up in the hand. Of course you can. But just looking at his anatomy, if you were a medical professional placing an IV, you probably would pick the largest vein, not a smaller vein in the hand. So that's just a small note. Any questions about that?
Just looking at both of his hands, I know the veins will be different. I don't even see, if you look more up to his wrist, you'll see the vein. I don't even see anything beginning to head towards the bruise that approximates a vein. So I don't know what they would be going into. I mean, it could be, I could be wrong, but
yeah, there may be a vein there under that bruise, but there's no prominent vein that's visible. Again, that's a photo from just a few months ago. His venous anatomy has likely not changed much from a photo from just a couple of months ago. So the third clue, because there has been so much scrutiny of this bruising on his right hand, it seems most likely to me that if he were receiving IV infusions, they very likely would not keep choosing his right hand as the place to continue to place the IV. there's plenty of other choices. For example, the non-dominant left hand, or in this case, because he has a tendency to wear long sleeves most of the time, except when he's golfing, you can place IVs up here in the arm, or commonly right here.
Commonly up in...
Yeah, exactly right. So to my mind, just logically thinking, if he truly were receiving some sort of every 2 week or every month IV infusion, it would probably be IV placement in some spot on his body that's more hidden.
Yeah.
And less likely to create a problem. So these details really seem to point away from the possibility or point away from the likelihood that he's receiving some kind of IV infusion, at least some IV infusion in his right hand as the causing of the bruising. So what's the other possibility that we're kind of like looking at here now? You know, the White House explanation, handshaking. So let's have a talk about that for just a second before we close this video out. Number one, it is true that Trump shakes a lot of hands. You cannot argue that. But I would add this detail. I'm speculating a little bit, but I don't think that this is a stretch, that Trump has a tendency, just because of the position that he's in, he's the president and who he's around, that he'll tend to shake the hands of very powerful people.
Yeah.
And he'll also have a tendency to do a lot of handshakes with things like athletes, MMA, or like NFL. He was just at the Army-Navy game. So I'm sure, you know, there's a lot of glad handing going on at that game. He flipped the coin at that game, actually. And so both of those examples, either very powerful people or large men, big, large men with big, large hands, on average, those are the kind of men, and I have exchanged handshakes with people like this in my lifetime. There's a certain grip, a firmness of grip that can happen with people that are powerful. It's almost like who's got the stronger grip and, you know, that kind of thing.
Yeah.
Or if it's a very large athlete with gigantic hands that could wrap all the way around the hand of the person that they're handshaking. You know, to my mind, it is not out of the realm of possibility that it could be one handshake is all it takes. One rough handshake where the thumb, I can't do it because I don't have two right hands to interact here. But that thumb will get all the way around the top of that hand. And if it's a tight enough squeeze, all it takes is one handshake to crack a blood vessel. So number 2 point, we already know it is confirmed that he does in fact take a daily aspirin. And as I've mentioned in other videos before, the aspirin is an antiplatelet drug. It's intended to help to reduce the risk of strokes, etc. And a person who's on aspirin will be more likely to bleed a little bit longer. So if he were to get a strong handshake, it cracks a blood vessel, tiny blood vessel open a little bit. Those platelets won't stick into the crack in the blood vessel. And so that blood vessel will leak blood longer than average, which is the intention of aspirin. So you get a larger hematoma, a bruise that you can see that kind of lasts longer. And then the last point that I'll make, kind of evidence that maybe it's trauma of some sort. So I say handshaking as a possibility. In my many years of practice, almost 20 years, I've seen thousands and thousands of people in internal medicine and geriatrics, seen lots of elderly people, of course, and as is really obvious at this point, the older that we get, our skin has a tendency to get very, very thin. And commonly, doctors, providers will see, for example, women who like to work in their garden as a common thing that kind of aging women do, and they'll work in their garden, and they're all ripped up, the skin, the tears and the cuts and things like that. very easy bleeding and skin ripping and bruising and the hematomas, or in men of, again, advanced age, have a tendency to be working in like their wood shop or maybe working on their cars, and they're banging their hands on the stuff that they're working on, and they have the same thing, skin rips and the tears and the bruising and all the things that go along with that. So this is something that we see commonly. Trump, of course, is a golfer, and, who knows if he bangs his hand on, on the Resolute desk as he's walking around the Oval Office or wherever else in his life that he may experience some hand trauma. Now, it has a tendency to always be on that right hand. So that's why I sort of lean towards that excessively strong handshake that he probably experiences occasionally.
Yeah.
But let's look at the last picture and we'll see a characteristic appearance of the skin of a person of advanced age, about 80 years old now. So go ahead and have a look at that last pic. And you tell me what your observations are.
Alarmingly loose skin.
Loose skin. Yeah.
Loose skin is what I'm
that's
seeing.
really all that you need to say. And would you say that skin looks well hydrated and very pliable? Or would you
say no?
Really looks more thin, more fragile, and those those blood vessels that are kind of just underneath that skin, the same thing is occurring. That's what's lost in a person with advanced aging. And so, to put all the pieces of the puzzle together at this point, as best as I can tell, the handshaking / other hand trauma that occurs, by bumping that right hand certainly seems to be the more plausible explanation than he is receiving a regular IV infusion of some kind of medication, maybe a medication for Alzheimer's or dementia or some other IV medicine that he's getting on a regular basis. I would have to lean towards actually the White House explanation being probably more likely. Now, all that with the caveat, and it's a huge one, this Trump health kind of mystery, it continues, and the information that we get out of the White House continues to be not good, not adequate, not complete. Yeah. So I certainly will leave it open to the possibility that anything may be going on here. What are your thoughts at this point?
I have a few things to add. One is Trump has had a habit, and he's bragged about this, about when you shake someone's hand, you got to pull them in and pull them into you.
Oh, yeah.
Like, grab them and yank them.
That's true. He does do that.
He's done this forever. He has this habit of already being hyper aggressive with his handshakes.
Right. Yeah.
Personally.
Yeah.
So I'm sure when you're grabbing somebody else's hand, like, I don't know, some president of some other country, they're not going to just get bullied around. Macron was going to get in there.
I was going to say, like Macron or Trudeau.
The only other thing that I have is that these bruises aren't always present. And I've not kept track of this information. Is how reoccurring are they? Is there any kind of pattern? I don't know the answer. Maybe a viewer will know, or we can find out later. Yeah. But if there's, like you said, these medicines are given, you said 2 weeks and 4 weeks? Mm-hmm. So if there's any reoccurring pattern that you can almost begin to predict when a new bruise will appear.
Yes.
And if it was handshakes, we would expect it to be more sporadic and not a pattern. Not predictable.
Pattern. My initial answer to that is there doesn't seem to be a very regular schedule, like it's been exactly 2 weeks or exactly 4 weeks, and here he is again with the same,
I agree,
bandages. Yeah. So it doesn't seem to be that regular. In fact, the hand bruising thing was a little bit off the radar for a while. It feels like more than a month. Again, it brings me back to what seems to be more likely is kind of intermittent and sporadic with no regular pattern, which is what you're getting at as to the appearance of the trauma on these hands. So if I were Trump's doctor, I would start to advise him to offer a left-handed handshake for a while. And let's see if we can get some bruising on that left hand. to sort of equal out and really get us
Get an ice
speculating.
pack maybe on this hand every night before we go to bed or something.
So anyway, that closes out this Trump health update. Appreciate everybody watching. You can find me on BlueSky. Max, where can they find you?
Obviously, I call it Twitter. You can find me there. TikTok, BlueSky as well.
Glad to have you today, everybody. Thank you for stopping by for this most recent Trump health update on dementia and IV treatment for dementia. Have a great week, everybody.